The first questions come for Louise. Louise, well, Lovelyn would like to know what's the difference between field epidemiology, epidemiology and biostatistics. And the second question comes from Abbas, who would like to know about the trainings that you've provided to support the low middle income countries, whether these are online or in person, and whether one can access such training for 2021 amidst the pandemic.
Thank you. Okay, so the first question about biostatistics and field epidemiology. I guess you might find there is a range of different opinions on that, but I would say that you know, we expect our field epidemiologists to be proficient in biostatistics, but primarily we expect our field epidemiologists to be able to deploy a wider skill set beyond analysis, including, you know, program development and surveillance evaluation and science communication. And so I think they are obviously closely related. I'd say, if you refer you back to the sort of competencies that we identify for the field epidemiologists, and say biostatistics is really integral and really important. But also I think the key is in the fact that we're focusing on intervention epidemiology. And so it's applied epidemiology, I would say, particularly in a frontline programme. The second question is a bit more difficult. So I'd say that in terms of, from an FETP point of view, as a partner, I think where we can be most useful is actually helping to collaborate with different bodies around the world who are either establishing an FETP, whether that's an advanced level or a frontline level, whether that's helping to evaluate training programs. So I think our role from an FETP point of view has occasionally been to deliver some training, and we certainly have done delivery of training. In the past, that's often been face-to-face, but I think our preference is to actually help support and partner with other agencies and bodies who are wanting to develop field epidemiology training. And of course, as many of the speakers today have outlined, there's a lot of really excellent material on many of the websites. So the Knowledge Hub, Go On, TEFINET, there's a lot of e-learning materials available through those routes. So I think we'd like to focus more on supporting building up a field epidemiology training and FETP specifically. I hope that answers your question.
Thank you, Louise. I also hope that answered the question for Abbas and Lovelyn. We'll move on to Mary. So there's questions, Mary, and interest about the Masters and how people can enroll for it or get scholarship for the Masters in Emergency Response. Over to you.
Sure. We are currently working on going through the required processes for the development of the Masters. As I'm sure you can appreciate that because it has academic credits attached, there are some formal processes that need to kind of be traversed before we can actively launch it and give specific details. So we're nearing the tail end of that at the moment. So I anticipate that we would be hearing relatively soon with regards to the details of the course itself. Naturally, we have ideas of when the course is hoping to come out, but I would hate to say that now, only to disappoint. But I think definitely it would be announced on the Knowledge Hub that Rosanna mentioned, as well as through our interest groups, as well as on the London School of Hygiene and Tropical Medicines web pages. So I imagine in the next few months, we'll be able to be promoting that. And I'm also seeing the questions around the scholarships for the master's programs. Equally, when those notifications go out, there will be notifications with regards to applying for scholarships. And that is something that we have discussed and we feel is highly likely to be available. So definitely keep an eye on the interest group notifications as well as the Knowledge Hub and the London School sites. It will equally be shared on those three platforms.
Great, thank you very much, Mary. The next question's for Nick. One question is specifically around whether you're planning to work in Ethiopia. And a question from Emmanuel, who's working for the International Medical Corps, asking, you know, how can people like him join your organization?
Sure. Well, first of all, IMC is a great organization. I remember first working with them in Haiti and again in Liberia during the Ebola outbreak. But I guess, as I mentioned in the presentation, we're a request machine. So the function by which we will work in a country, and in some ways I'm jealous of the PHRST because the PHRST has a really admirable focus on capacity building and work in advance of an emergency, which again, I think as we can continue here is the best way to respond, is to already be there, or as Dan had said, to work your way out of a job. But as we are, just by our nature, we are this sort of response mechanism. So when there is a request received for a response that comes either through the WHO or by the host country, or potentially through our FCDO country office that identifies, you know, a need. That's generally what triggers the EMT deployments. EMT deployments are also designed to be shorter term, meaning, I mean, the original remit with the WHO is for emergency medical teams, which could be, I didn't mention before, which can be as small as a small team of experts, or as large as that, 20 to 40 bed field hospital that weighs 85 metric tons and takes up an entire, football pitch. The capabilities designed to be there for less than 6 months, even though sometimes we're there for longer. And then in terms of people joining, definitely we can post, I guess, PHRST colleagues in, if they want, post the link to sort of register with the community of practice, similar to the wider PHRST. But again, as sort of Dan mentioned, we in the same way are we're really selecting people with very specific expertise. But again, our vision has come very wide this past year because we've recruited a lot from places outside the UK. So I hope that helps.
Thank you for the comprehensive answer, Nick. There's some questions coming around further training in epidemiology. Is there any PhD support schemes for epidemiology or other programs related to epidemiology that people can follow their training on? Open to all our epidemiologists.
So I can jump in briefly, Alinda. I mean, there are really a massive, well, no, compared to the interest, it's probably not massive, but there are a variety of scholarships and training programs through different schools. I know about the London School of Hygiene and Tropical Medicine, it's my alma mater, but Liverpool School, Glasgow, different schools. What I would suggest for those, if you are looking for that kind of academic masters, that you go on the website of the university you're thinking of, and certainly on the London School, there is a page for scholarships. So as RST, as Mary mentioned, at this stage, we're not able to say, okay, we'll have a scholarship for our pandemic course. It's something we hope to be able to think of, but we don't want to raise expectations. But I think looking for academic scholarships through the sites of the universities and the colleges that you would like to attend is certainly one way to go. Maybe Ashley has something further to say. No, shaking his head, but that's what I would suggest. Over.
Thank you very much, Hilary. There's a question about joining the public health network. I guess it's the Global Health Network. Rosanna, how can someone join the Global Health Network if they wish to?
Yeah, so I think we've posted in the chat the link to sign up. So if you follow that link, we'll put it in the chat again. And then you can register to become a member, and then you can join our community of practice and participate in blogs and comment on discussion groups and so on. So yeah, we'll post that again in the chat, and you can follow that link. Thank you.
David is asking, who do we contact for collaborations in response to capacity building grants, which require an integrated team of HIC and LIC?
Okay, so I'm going to come in here again, and perhaps Ashley would like to follow up. So David, I think you might remember that I said that we're not a funding body. So we don't look at somebody's proposal and say, we can fund you. What we would need is to make it a collaboration. So if there were ideas that you would want to develop and you come through your institution, this is not an individual, then you would bring that request and a proposal, and we would then try to look and see whether we can take that on board, whether we have the kind of capacity that could support you in that. Just to keep in mind that there are nearly 200 of you on the webinar, and if you all send us a capacity development proposal, we might take a little bit of time to respond. But that's the principle, yeah? So it's ideas and proposals that would involve a collaboration between the RST and the institution in the country, not a donor-grant relationship. Over.
Thank you for clarifying it, Hilary. Alexander is asking, can a nurse be eligible to do masters in epidemiology? Ashley?
Yes, in a word, absolutely.
And Shanna's asking whether there's any age restrictions for that.
Okay, I'll answer that. I did my master's in epidemiology. I'm not a nurse, I'm not a doctor. I have no medical training, but I have a public health background. And I was, let's say I was over 50, just to be kind. Over. Great.
That's fantastic. So Shana's is asking, she's a member of the Global Health Network. Does she need to sign up for UK-PHRST, Rosanna? Updates?
Yeah, so you can become a member, but yes, it's best practice to sign up to each hub. So yeah, you would need to join our hub through that link that we've provided. And that way you can sort of receive direct updates from ourselves and like I said, participate in other things on the hub.
Thank you. And we've got a question from Landry earlier on. What can be done for development of research in Central Africa? It's come to Hilary and Ashley.
Okay, so I didn't catch the name. Was it Lansana?
Landry.
Landry. So Landry, I think if you think about what I just said, so what we would be looking for is to have your, I don't know who you work for, but you and your institution identify a research area that was related to outbreaks or outbreak-prone diseases, and then you could contact us with that suggestion, but that isn't a guarantee that we would be able to then work together. But it would be something that we would need to work together on to develop that proposal to see whether that proposal fit our sort of area of knowledge and interest and yours. That's the way we would go about it. Of course, if we're deployed to the Central African Republic, if your ministry were, for example, to request a team to come and support a particular aspect of an outbreak response or preparedness for outbreaks, that could also be another channel, because then we would look at different questions and different aspects of where we could support Central African Republic and where, you know, your teams and our teams could work together. Over.
Thank you, Hilary. And there's questions come, what form of collaboration are you having with other research organizations like MRC UK?
Okay, so they come to me. So I think the thing, I mean, we collaborate, for example, in the Gambia. There was a lot of discussion with the MRC in our recent deployment about what MRC is doing, what we might be able to support with the ministry, with other partners. What we want to do is build a research capacity within the local structures, the ministry structures, the national structures. But of course, if there is an MRC unit in, for example, in the Gambia or in Uganda, there may well be collaborations that could take place with that. I would say that we don't want to duplicate and sort of pile support on support. We want to make sure that that support goes out horizontally as well. So it's less to do with directly relating to MRC units and more to do with how RST, MRC can then work with the research groups in the country you're in. I'm not sure if that's clear, but tell me if it's not. Over.
Thank you, Hilary. That's great. So we're getting some questions. Abbas is asking if you can access the online masters in epidemiology fully funded. So I think Abbas lost connection when Mary was talking about the development of the masters. So that's still being under development, Abbas, and hopefully we will have some scholarships. But yeah, we'll inform everyone, especially through the Global Health Network as well. Okay, I'll check if there's any more questions coming through. There's a question about from Shanaz if there's any online jobs for those in LMICs. I know we've kind of tried to answer this question, but it keeps coming up. People who want to participate and collaborate and work with UK-PHRST. Ashley, would you like to answer that?
Yeah, I guess I hope this answers your question. Maybe I've not fully understood what you mean when you say online jobs. In terms of collaborations, I think just to re-emphasize really what Hilary and Dan and others have said, we are very much welcome new collaborations. We think the best way to work is with public health institutes and academic institutes around the world, so we can align ourselves to your strategies and priorities, and also participating in global networks. Really, those are some key ways we work, and we want to continue to work. So yeah, opportunities through your institution. Please think of these things and think about how we could work together, how we could support and welcome contact from institutions or from networks or with and through networks. Thanks.
Great. Thank you very much, Ashley. And at this point, I'd like to thank all our speakers and all our attendees.